I'm Julia Philippi, and I am here with Katrina Despinos, who is a dual certified CNM FNP, who's been out in practice for a year. And she is going to talk a little bit about kind of a typical week for her, a week in her life. So Katrina, I'll turn it over to you.
Okay. All right. Hello, everyone. I am currently a midwife in Providence, Rhode Island. Yes, like Julia said, I've been practicing for a year, and I think it's been a good year, a very learning year. I feel very different from starting to like now, and I still love midwifery. So let's see, like a day a week as a midwife. So my practice, that's full time. We do 2.5 clinic days, so 2 days a week, and then a half day from like 8 to 12, and then one 24-hour call a week. So, and that averages, I think, about to like 44 hours. And our 24-hour call is from like 8 a.m. to 8 a.m. the next day. And so, yes, we do night call. It's only one of us at a time. And we average, I believe, about somewhere between 30 to 50 births a month. So in my typical like clinic day, I will see antepartum patients, and I'll do prenatal care, and I'll also do GYN care. So I do PAPs, I do annuals. Sometimes I'll even get to like see someone for depression or anxiety. I also do STD testing, vaginal infections, so like yeast infections, bacterial vaginosis, any concern that someone has gynecologically, I get to do. We also definitely do, since we do antepartum, we also do postpartum, and then we do a little bit of preconception care. We actually have a preconception program run by our primary care docs within our group. That's pretty awesome, but we get to do it as well as midwives. With doing 2.5 clinic days and one call, I'm one of 9 midwives. So I think that's a pretty, like, it gives a good like work-life balance. And we all work together kind of like pretty well and like as a team and pretty similarly. And I can say that because I got to like precept when I first started with everyone, and I was like, you all do work the same. So, and we all went to different schools. Some people went to like Penn, some people went to Vandy, well, me, and then others, Yale, and then other schools as well. Like our main population is definitely insured, but we take some like community insurance, like state insurance, like neighborhood health is what we take. And we range really from like teens, like some of my coworkers have definitely taken care of people since they were teenagers and then into like pregnancy and on. Our ages so range from like teen all the way to like about, I would say 50, because we actually have we are part of a women's medicine collaborative. So there's GYN, there's primary care, there's OB, there's behavioral health. There's so many of us in one clinic, and our GYNs who are usually over 50 or over 60 go to the GYN clinic. But we do get to see a range of ages. And I would say primarily our population is Caucasian. And then there's mixed of like Asian. There's a huge African culture here. So lots of Cape Verdeans, which is really cool. And as I'm Haitian, there's Haitians also as well. And then like Black American, on the smaller side of the populations of like people of color, but you still get to see them. Tidbit, I am the only, I believe, Black midwife in Rhode Island, but Rhode Island's also an hour long. The entire
it's a tiny little state.
Yeah. What's it called? We do a lot of like, we are a very oversharing practice in the sense of like, we do a lot together. So there's 9 midwives, there's 9 docs. Our docs are like right next to us. Like they have their offices right next to us, but we all work together pretty well. So if I have a question, need to consult, I just walk over and ask them. There's always a doc on call with us. So if I need to consult or anything like that, we take care of low risk, but also high risk patients as well. We do anybody who has diabetes or high blood pressure that's not on medication. And we take care of them in labor also. We do we have an alternative birthing center room at our on our labor and delivery at the hospital, which you can birth in, that has a tub in it, and it's very quiet, a large electronic bed that goes up and down. And it's a pretty cool space for people who want to go natural. And then of course we also have the labor and delivery rooms, some with showers. And let's see, I was going to say something about the doc side. There's 9 of us, there's 9 of them. Well, I don't remember what I was going to say.
I'm sure it'll come back to you.
Yeah, it'll probably come back to me. But, oh, that's what, yeah, it did come back to me. So like I was saying, we are very oversharers, or we just over communicators. That's the word I'm looking for. Besides just going to clinic, we do meetings. We have a midwife meeting every other week. So we get to talk as just a group of midwives about anything that we need to discuss. And we have high risk meetings every other week, opposite of the midwifery meetings. And our high risk meetings are when we just go through all of the patients in our practice, with the docs and the midwives, and we talk about what should, and our MFM as well is there, and our OB docs who do primary care for our pregnant patients. We get to talk about the plan of care for a lot of our patients. So great collaboration. And then we also do a lot of educational, because some of the residency school, Brown University is here, and that's where they have residents, and they present a lot. So every week you're watching a new presentation, and it's also how you get CME credits and all that stuff, and you get to learn. And it's run by the hospital that we deliver at. So usually Tuesdays, Wednesdays, and Thursdays are meetings in the morning, and then go to clinic. Or if you're on call or anything like that, that's usually how it works. So yeah, that's a week.
That's fantastic. Yeah, that is a lot of great information. I think for people who are interested in what midwives do, I think you give them a lot of great, here's all the places I get to be in and grow and help people. It's really nice.
Yes, thank you.
So what is the hardest part of being a midwife? Because it's lovely, and I can hear, as I've always been able to hear in your voice, your passion for it. But what's the hardest piece about living the life of a midwife?
I would say, I feel the hardest piece is sometimes getting people to trust you, that it's that 2 a.m. phone call when you are talking to someone who's in, I would say early labor, or just has a question, and you are trying to give them advice, or trying to be this is my viewpoint, things like that, yada, yada, yada. And they're just I'm just not so sure. And I'm no, we have prepared you for this. You got this. This is my advice. Listen to me. Or even in clinic also, if someone's really concerned about something, I really work hard to try to get them to trust me and be no, I would never let anything happen to you. I would say that. I would definitely say, so trying to give your all, and be supportive, but also be I need you to trust me. Yeah, that feels hard sometimes in midwifery. Trying to figure out when I feel I've done a really good job on my keeping on top of my charting, so I'm happy with that. But trying to figure out when am I going to call all of these patients? When am I going to finish all of this charting? And finding a work-life balance. I think my job, I feel I have a really good job, and my hours overall are really good. There's always room for improvement, I will say that, but I do. And so on the days that I'm off, or the days that I work half a day or something like that, I'm very intentional about self-care. And I think that was really hard beginning as a midwife, because I was just I gotta keep learning. I gotta keep learning. And I had all of these ideas of the type of midwife I was going to be, and I was going to change the world and be a community person and all of these things. And grad school prepares you for all of this, but then you're also learning. So trying to rest when you need to rest, not get frustrated at 2 a.m. when you get a call, or if you haven't slept all night, that's really hard. And some people have families, so they go home the next day after call, and they just have to take care of their kids or their dogs or whatever. So those are the hardest part. And learning to trust yourself also, that's really hard. Knowing, especially in the labor or birth, being do I need my backup? Do I not need my backup? How is this going? Like, is this a good trajectory of labor and birth? Like, should I do something different? Like, going through all the scenarios in your head, and also, yeah, getting the staff to trust you as well.
Yeah.
Yeah.
Yeah, those are the big first year.
Yeah. And I think I'm getting there. So, but I think you start off with like getting them to trust you by being a helper and helping out and trusting them. So those are the hardest parts.
What are the best parts for you?
I really enjoy, one I really like, it's shifted a little bit. Like I used to like love like antepartum more than like GYN, and now I like kind of really enjoy annuals because I love getting to know people and like work on things like self-care, and annuals is like my number one thing because I think it's not talked about enough. And like, you know, people's like mental well-being is also something I love to talk about. So that, getting to know people, I really like reviewing like postpartum visits, especially for babies. Like I have caught the birth experience. One, I feel like it helps me be a better midwife. Two, I feel like people just need to talk about their birth experience, whether it was great or maybe a little traumatic for them. And I just want to provide them with that opportunity to be able to do that. And then I swear, catching babies is just pretty awesome. It never gets old. It never gets old. And now that I have shifted from like the very nervous, like new midwife to now I get to like focus more on like, look at that baby, like restitute, and look at that baby, just do what it, you know, what it needs to do and what it's doing. And I don't have to do anything. Like now like everything has slowed down in my brain and during birth, and that's pretty awesome. And then getting to like work with a team. Like if I could give anybody anything, I wish I could give every practice like a good team to be around. And I have had nothing but support from my coworkers, and I couldn't have asked for a better practice. So definitely the team is awesome. So yeah, I would say those are the best parts.
Oh, that's just delightful. Anything else you would want to add for somebody who's thinking about coming into midwifery?
Yeah, I would say, well, I'm always going to be biased. I love Vanderbilt's program, but there's that. It was tough, but it is so worth it. And you will come out as an awesome midwife and be very well prepared. And don't like, it'll get hard, but you know, you guys got this, and you just keep going. And the clinical sites will like when you get to clinicals, you'll really get to learn like, oh, like you'll get to do what you're learning, and that's pretty awesome. And there's so much support in the program, so use it. And also like enjoy like life while you're in the program. So self-care while you're in the program too is very important. Yeah, that's what I would say.
That's super helpful. Thank you so much.
You're welcome.